July 24th. Today's the 25th. On the 24th, I had a meeting with my oncologist. I have laryngeal cancer. And I refused treatment. I'm going to put this mask on because it makes my throat feel better. So, prior to that, I had had a scope that looked at my larynx, and I recall that the ENT had told me that my cancer was the same. The lump that was on one of my left vocal cord that was paralyzed had not changed. But today I found out that in his report he said that it had slight progression. I feel better than when I originally went to the doctor about this problem. Distinctively better. And in conversation with the main doctor that's in charge, I guess, of the entire cancer treatment, now I have service through Kaiser Permanente here in Atlanta. He was Dr. Patel. He was the only one of these people that I have talked to that knew anything about metabolic treatment of cancer. He was helpful in the way, it was helpful just the fact that he knew. He could not approve or disapprove of it because, of course, we know that it is not mainstream. The other two doctors knew nothing about it. They were completely unaware of it. I sent them some information, but they just don't know about it. They're focused on chemo and radiation. And it's scary the way they talk to you because they tell you, that you're basically a fool. One of them compared just asking about metabolic therapy to crystals, which to me is like amazing. The other thing that I have a concern with is that I know that medicine is a business, and business can be ruthless, intentionally or not intentionally. So I would believe that these doctors that work for Kaiser are trained in a certain way. By saying that, I mean they are trained to accept certain therapies and reject all others. As I understand it, Kaiser in Atlanta here has recently opened this therapeutic in-house care for cancer, where they do the chemotherapy and the radiation in-house. Of course, for these particular doctors, it would be devastating if their patients stopped using, a procedure that they have just developed. Also, if they don't know about it, how can they give any advice? But it is troublesome to go to a doctor and they not know anything about it. You would think that Kaiser or the doctors at Emory that I have seen would have at least told me about these things I discussed originally. I went to Emory for some advice, and they had told me that they did not do immunotherapy. And at that time when I went, I had not done enough research to understand about the metabolic approach to cancer. And well, this is the first of the videos that I'm making. As I said, I rejected chemotherapy yesterday. It felt very strange. Feels like I'm a crackpot. But the more I look into it, and the way I feel, I've lost about 22 pounds since this all began. The way I feel is considerably better as far as my throat. I mean, I still can't talk. My vocal cord is still paralyzed. But the sensation that I felt has pretty much gone away. So, again, the main doctor said that we could do another MRI in about 3 weeks. I'm eating very little. I'm having a hard time completely getting rid of bread, especially at breakfast. I had a couple of slices of wheat bread this morning with some chicken, and mayonnaise, tomatoes, basically a chicken sandwich and a glass of milk. And tonight I'll probably eat half of an avocado that I have, and maybe some peanuts. But as I progress, hopefully I'll learn to focus more on a more solid protein diet. And, well, we'll see. We will see. And, I'm going to start putting together this information as much as I can. And hopefully it'll be helpful to others that have this situation. If I have to go through a laryngectomy, then I'll post that. And I wish I had more information that I don't have to go searching everywhere for. So, hope you this is helpful. And we'll see. We'll see. Let's keep in touch. I'll return with another video soon. Thank you.